go ahead and introduce you?
Yeah, I'm just going to line this up. So
Yeah, that sounds good.
should I wait a minute? Sounds like we're a little early. Or
That's all right. I'll talk for a minute or two, and while we wait for maybe some stragglers to come in. Hi, everyone. My name is Matt Bowes. I'm the reference librarian and assistant director here at the library. Thank you for coming out this evening. Before we introduce tonight's speakers, I just want to mention a couple things to you. We have a bookmark of our other upcoming events on the back table there. Actually, next week we have a really interesting event. We have an author coming who's going to talk about 40 soldiers in World War II who were from New Hampshire. And she's done a lot of research, and we're going to learn all about their lives. Should be a very interesting program. That's on Thursday night at 6:30 next week. We also have evaluation forms back there. If you don't mind giving us a little bit of feedback about tonight or about anything else you'd like to see happen at the library. Any feedback at all is great for us, so please take a minute to fill those out and drop them in the colorful box back there. And with that, that brings us to tonight's program. We're very fortunate to have AARP here tonight to talk about the new healthcare law. I know this is on everyone's minds right now. So Doug and Roger are here with us this evening. So I want to thank you for coming to the library to share your time and expertise with us, and I'll turn things over to you.
first of all, my name is Doug McNutt, and I'm a staff member at AARP. We currently have an office here in New Hampshire in Manchester, but in about a month we'll have an office in Concord. So, for what it's worth. And we are going around the state, and I believe we have 60 of these presentations planned. 40 in public libraries. We're going to be all over the state. We do a lot of educational work here in New Hampshire, and I think nationally. I think you see us working on issues like Social Security and Medicare. Locally, you may see some of our tax aid representatives. I don't know if the Hooksett Library has tax aid people here, but we do a lot of tax aid work, filing tax returns for low-income people. We have a driver safety program that I hope maybe you've seen. So sometimes you can get a discount on insurance by using that. We have a great fraud unit that goes out and gives presentations on frauds, both regular frauds, Medicare frauds. So we do a lot of things in the community. And the other thing that we've just started to do is we've started to have local discounts. We have one this Saturday, actually, at the Courier in Manchester. We're going to have one in November at the Milliard Museum where we've had discounts. We had one at Strawberry Bank last week where we had discounts for members. So we're doing a variety of things, and I think sort of one of the fundamental things we do is provide information, and that's sort of what brings us here tonight. We have over 225,000 members here in New Hampshire, and here we are. So I'm Doug McNutt, I'm a staff member, and Roger.
And I'm Roger DeRozier. I'm a volunteer for AARP, and I'll be doing some presentation this evening with Doug.
So I'll kick this off, and all right, here we go. I got to the agenda. We're not doing too bad. So what are we going to do here tonight? We're going to talk about what is the health insurance marketplace. You might have heard the word exchange used in the past. They're basically the same thing. We're going to talk about who can use it and how. We're going to talk about options for people whose incomes are below certain levels and what kinds of help they might be able to get. We're going to explain what the law means to people with existing coverage. And then we're going to tell you where to get resources to help you out if you're looking to sign up for insurance on the marketplace. Now, I want to sort of start with a caveat, which is that Roger and I are going to be helpful. We have some information here, but we're not experts. And the other thing we cannot do is we cannot sign you up for the plan or determine if you're eligible for a subsidy, but there are other people who can. And there's information further on in the presentation that tells you who can help you locally. And there's information on the back table as well. And for instance, Service Link is listed there as an option. So we will give you lots of places to get more help if you need it. Our kind of goal here tonight is to kind of tell you what's out there, give you some information about dates and times and what there is that you might be interested in. So we're going to do that. And if you have any questions, we'll answer the ones that we can, and that's what we're going to do. So the first thing we're going to do is we're going to start out with sort of a funny cartoon that I hope you'll find enjoyable. And the purpose of doing this is to kind of give you an overview. This is a YouTube, and it's a little sort of a fun way to learn about this. So I hope you enjoy it.
Well, it's finally happening. After years of drama on Capitol Hill, a Supreme Court case, a presidential election, and a Mayan apocalypse that could have stopped it dead in its tracks but didn't, the marquee elements of the Affordable Care Act, sometimes called Obamacare, are about to kick in. And big changes are coming to health insurance in 2014. In the next few minutes, you'll get a pretty good lay of the land by once again watching your fellow Americans, the U-Tunes, find their way through the system. There are 4 main ways nearly all of us will experience health care once the health reform law goes fully into effect. About half of us will get insurance through our jobs, just like today. About a third will get covered by the government through Medicare and Medicaid. About 1 in 10 will buy insurance themselves. And unfortunately, another 30 million of us or so, just under 1 in 10, still may not have coverage at all. But let's begin in the workplace. Many Americans are already covered by their employers, and for them, not a whole lot will change. There will be some new advantages, though, like caps on how much you have to pay out of pocket, and free preventative care. The bigger changes are coming for those who work for larger companies but aren't covered now. That's because the government is going to require companies with 50 or more employees to cover full-time workers or pay a penalty. So, more workers may find themselves covered. Smaller employers won't face the same penalties for refusing to buy insurance, but they'll be encouraged to do so. The government will be setting up special marketplaces to make it easier for small employers to take the plunge. Some will be offered temporary tax breaks if they do. And unlike now, insurers can't inflate prices if some employees are sick. So many of us will be getting covered at work. A lot of us will be covered with help from the government, just like today. Not much will change for seniors on Medicare. The law has already started helping with prescription drugs and better preventative care, and that will continue. Medicaid, on the other hand, is expanding to cover more of us, especially poor adults, many of whom aren't eligible today. If your income is low, Medicaid will cover you, most likely in a private insurance plan. But there's a catch. The Supreme Court ruled that governors and legislatures of each state should decide whether or not to be part of expanding Medicaid. In states that get on board, the feds will cover almost all the cost. But for those who don't, you may be left with the same options you have today if you're poor. So you'll want to check out your state's decision if you think you might qualify for Medicaid. Even with employer coverage and the expansion of Medicaid, a lot of us will still be left out. For those not covered or who find their work coverage too expensive, a new way to buy insurance on our own will be popping up everywhere. They're called health insurance marketplaces, though they may have a fancier name than that in your state. The health insurance marketplace is like a virtual insurance mega mall. Here you'll find private insurers competing for your business, and you'll be able to pick out how much coverage you want and how much you want to pay for it. From cheaper, high-deductible bronze plans to more expensive platinum plans. Still, all plans will cover a comprehensive set of services like hospital and doctor visits, maternity care, mental health care, and drugs. Most everything any of us need, at least when it comes to medical care. As with Medicaid, not all governors are on board to set up these marketplaces, but the feds will open their own in those states, and so you probably won't notice much of a difference. One big advantage of buying insurance through these new marketplaces is that the federal government will provide most people with a tax credit to make insurance more affordable if you don't have any other options and your income is below a certain level. In fact, most people buying on their own will be eligible for a tax credit and won't have to pay the whole premium themselves. And the marketplaces will make sure that insurance companies operate fairly under strict rules. They'll have to offer everyone insurance, even if they're sick. And they won't be able to charge more for pre-existing conditions. Unlike today, men and women will pay the same price. And prices for older people will come down, while young people will pay more. To keep costs down for young people, though, they'll be able to stay on their parents' plans until 26 and buy low-budget catastrophic plans until they're 30. Of course, all these changes still don't mean insurance will come cheap. Most people buying their own coverage will end up paying less with the new health insurance tax credits. But some people will have to pay more, even though many of them will be getting better and more secure insurance. So let's be realistic. Not everyone's going to run out and buy insurance. Some might say, hold on a minute. If I can't be turned down or charged more, why not just wait until I get sick or injured to buy insurance at all? Well, first, you can only get coverage during special enrollment periods. So if you snooze, you may lose. And second, thanks to something called the individual mandate, if you're not insured, you pay a fine, making this option seem not nearly so clever. Still, if you really can't afford to buy in and can't get insurance anywhere else, the government will waive the penalty, so don't panic. By now, you've probably noticed a lot more people will be getting a lot more coverage. Where will the money to pay for that come from? Taxes, many of them targeted at the health industry itself, even canning services. Yes, individuals will pay too, mostly the wealthiest Americans, who will be paying more into Medicare. Also, hospitals and insurance companies participating in Medicare will get paid somewhat less. Not painless, but somebody's got to pay. So, as Americans prepare for 2014, how will you be covered? How would you like to be? Now's the time to figure it out and get on the path to setting yourself up for the best insurance at the best price. After all, who wouldn't want that?
Okay, I just wanted to say that sort of like explains our whole presentation. But nonetheless, we are going to go forward. I think, you know, that was put up by that was not an AARP presentation. That is from the Kaiser Foundation. And I just thought it was a nice, we thought to put it out there because it's a nice kind of overview. I apologize as I'm struggling
I
here.
think if you go to the bottom there, the icon right below that, on the,
Down
yep,
here,
right there,
okay,
that should
sorry.
be it.
Great. I'm not used to using this, so you'll have to just bear with me a little bit. So at this point, I'm going to introduce Roger, and Roger's going to carry on from there. But I just thought that was a nice, oops, I'm going to do it if I can get to the next slide. Hold on.
There you go, yep.
Well, while you're doing that, I'll get started a little bit. As Doug was saying, that's a quick overview of the information that we want to share with you this evening. But there are a few more details we'd like to add that hopefully will give you a better insight into some of the key parts of the Affordable Care Act and how in New Hampshire it is likely going to work. The first thing we want to talk about is the marketplace itself, because the marketplace is where you would go online to get information about the various plans and the various eligibility requirements, a whole host of other information related to the plans that are available to you. As was mentioned, the enrollment period began October 1st, but you have actually until much past December to get enrolled in. In fact, you can go to March 31st of next year. Those people who want to be enrolled and start their insurance on January 1st, however, must enroll by December 15th. In New Hampshire, the only insurance company that's in the marketplace currently is the Anthem Blue Cross Blue Shield. We expect that there'll be additional insurance companies in the next year and some multi-state plans probably coming to New Hampshire as well in either the next year or succeeding years. Anthem will offer 11 plan options on the individual marketplace. The plans offered in the marketplace will have several levels of coverage to choose from. And as mentioned in the cartoon, the so-called metal plans, bronze, silver, gold, and Anthem does not offer the platinum, but you'll see the other plans that are available. Now, the marketplace, how it works, health plans, first of all, have to meet the minimum federal requirements. And in those requirements, there are a number of things that I'm not going to get into all the details. But in order to have an approved plan and a plan available to the state of New Hampshire, you must meet the federal requirements. The choice of plans and levels are considerable, and that's where you need to study the plans themselves and see what is in your best interest and what is in your family's best interest. Because as you may know from health plans that you have right now or health plans that you've looked at, they're usually conditions. Everything from, you must meet a precondition of eligibility for your health or whatever. Thankfully, under this law, you will not have that particular problem. You'll have the choice of plans and levels of coverage. Information on cost will be explained in simple terms, meaning you'll be able to identify the costs, you'll be able to compare them easily. You'll know, what you're looking at in one simple kind of format. So you'll be able to compare costs, apples to apples. And you'll have a place to sign up for the insurance. You can do that online at healthcare.gov. And in there, you'll have these essential health benefits: ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorders, including behavioral treatment, prescription drugs, rehab and habilitative services and devices, lab services, preventive and wellness services, and chronic disease management, pediatric services, including oral and vision care. This is what I mean about each plan is going to at least offer the minimum number of these kinds of services. And these are available only in the marketplace, and they're available for individuals and families. Now, when we get to the plan levels of coverage, if you look to your left, you can see how the so-called metal plans play out: bronze, silver, gold, and platinum. As I said, in New Hampshire, you only have the bronze, silver, and gold. And if you look the next column over, the plan pays on average from 60 down to 90. And if you look to the right, what the average person would have to pay for the plan is 40% if they chose the bronze plan, and it goes down from there. So what it means is that the more that the plan pays, the less that you have to pay. And at least in terms of the individual pay on average. And all of this is based on an average or a typical situation. So again, I emphasize your individual circumstances may be different from this. Catastrophic plans. The catastrophic plan is really geared for those people that are 30 and younger and usually in good health, or those who get a hardship waiver from the marketplace. The catastrophic plan provides a high deductible, low premiums, however, free primary care visits and preventive services, no copay, and protection from high out-of-pocket costs. So you will notice that just like any insurance, if you pay less for the premiums, then you have to take your chances in terms of whether you're ill or you have some catastrophe that causes a major problem in your life.
Okay. So I think we go back to presenter one, which would be me. Okay, so one of the things about this is we've talked already, and you saw in the cartoon that there are tax credits to lower premiums for people to be able to afford this. One of the things that is key about this, that it only applies to health insurance that is purchased through the marketplace. So if you buy something not through the marketplace, you won't be eligible for the tax credits and other subsidies. You've got to meet income limits to be eligible, and we'll go through that. So there's two types of tax credits. There are premium tax credits that you take at the end of the year on your tax filing, or there are advance premium tax credits, which are paid directly to your health insurance plan each month and reduce the amount that you have to pay. Now, the eligibility is based on household income and family size, and your income has got to be between 100% and 400% of the federal poverty level. Now, you probably, FPL is federal poverty level. I can't fully explain that, but it is a formula that the federal government uses to determine eligibility for various programs. And so you will see that throughout our presentation, we're talking about the federal poverty level, and that's what we mean. If you see FPL, that's what that means. As I said before, in order to get these kinds of subsidies, you've got to buy this through the marketplace, or you've got to be ineligible for, you could have, it's possible that you could be eligible for coverage under this if your employer-based plan didn't meet certain standards. So that's another possibility.
Can I go back and ask a question?
Sure.
Somewhere in here, I read something about tax credits changing this year from normally when you had your taxes done, if it was 7.5% of your income versus now it's going to go to 10%. Does that mean that you don't even get that if you don't go on this exchange, that you would not get a tax credit at all?
I don't know the answer to that question. I think what you're asking me is, there's a provision in the tax code now where if you spend more than 7.5% of your income on medical, that you are able to get a deduction.
Right.
Now, what I'm talking about here is getting a tax credit based on your ability to afford this health insurance. So I don't know exactly how that plays into the
Yeah,
that
because if you went back
7.5.
to the slide before this where you said at the very top, it said a premium tax credit that you take at the end of the year on your tax funds.
Right.
So you don't know if that's in addition to
Yes, it is. My understanding is that what they're going to do is increase the 7.5% to 10% in the coming year. So you won't be able to take your medical tax credits unless your medical expenses got to 10%. And
But if you don't take a plan in the exchange.
if you don't take a plan in exchange, you're on your own as you are now.
Can I say,
Yeah, sure.
these tax credits refer to in the marketplace, which is a separate thing from filing your
Okay.
taxes.
Okay.
What this means is there are two different ways that you can, if you qualify, if you're between 100 and 400% of the poverty level, you go on the marketplace, you choose a plan, it will tell you how much your tax credit will be based on your income and your family size. But you can choose one of two ways to take it. You can take it at the end of the year, in other words, pay for the insurance yourself,
Okay.
and then you'll get the credit at the end of the year when you file your taxes for 2014.
Yeah.
Or you can get it in advance to help you every month. Every one of those 12 months, they would split it by 12, and they would help you pay the premium and send it directly to the health insurance plan.
Okay.
That's a whole different thing from tax credits. I know what you're talking
Yeah,
about.
thanks.
And we're going to touch more on that.
By the way, I'm a volunteer, and so I'm observing,
Yeah,
but I'm also
she's-
learning.
She's learning, observing,
mean to butt in,
and
but
correcting,
that was
so all
helpful,
at the same
yeah.
time.
Yeah,
But-
this pertains only if you are eligible for tax credit in the marketplace.
Okay.
It's important to know that, and I think we have another slide that talks about the advanced premium tax credits. It's based on projections. So what's going to happen at the end of the year if you do the tax credit, you'll get a credit at the end of the year based on what you're entitled to. If you do the advanced premium tax credits, you're going to get payment to the insurance company as you go along. You're going to have to make sure that your projections stay constant, because at the end of the year, you're going to settle up. So if you projected your income to be too high or too low, there may be an adjustment made. So that's the other difference between waiting till the end of the year to take a tax credit or getting an advance one. But obviously, to help you along the way, most people would want to have the advance if they could. Okay, so in general, individuals with employer-based coverage aren't eligible for a tax credit, except if the employer insurance doesn't meet that 60% of service and benefits. So effectively, if it doesn't meet the bronze plan's requirements. Or if your share of the premium for the plan exceeds 9.5% household income. And how would you find this out? There was a tool called the Employer Coverage Tool, which is at healthcare.gov. And you go to your employer and you fill it out and you submit it and see if you are eligible. Now, with any of these things, I'm gonna suggest that we get further on, that if you need help with these things, there are people that can help you with these items, so don't worry about it. You don't have to even get this on your own. You can go to a navigator or someone who can help you out. And this, I know this is a busy slide. So what's the point of this? Don't worry about this. This is, what I'm just trying to do with this is to show you what happens to people at various levels of income. So let's look at the first line for the sake of discussion here. If you're between 100 and 133% of the poverty level, that amount would be, for an individual, $11,000 to $15,000 a year. At that income level, you would be expected to contribute approximately 2% of income towards the premium for health insurance. And that would be in the range of $19 to $25 a month. And I'm not going to go through all the rest of these, but obviously as you go up, as your income goes up, your responsibility is for a higher amount of premium. So you get to the 400%, and you're responsible up to 9.5% of the premium, which would be $318 to $364 a month. So that's the purpose of this slide, not for you to memorize anything, but just to give you an idea how this plays out going from low income to high income and how it's graduated. That's really the kind of the point of this. Okay, so don't memorize, you don't need to. Let me see if I still. So, again, there's busy slides. The other thing I want to say is that for some of these topics, I have additional items in the back. I have additional copies that you can look at individually and take home with you. So, help with out-of-pocket costs. So there's an additional way that you can get help. If your income is at or below 250% of the federal poverty level, which is for a family of four would be $58,000, and you're receiving the premium tax credit, and you are enrolled in at least a silver medal level plan, you can be eligible for help with additional help with cost sharing. So if your out-of-pocket costs are significant and you're below that level, you can be eligible. So that's just something I wanted to let you know. Okay, so I've got 4 slides here, and again, I've got copies of these in the back, so I don't expect you to memorize these, and they may be hard to look at. I'm just going to take the silver plan here and walk across it. So for a silver plan for a single person, you would have a $500 deductible. For a 21-year-old, you've got a premium cost of $18, and $17 for 60-year-old. So we're just going across here and showing you what these particular income levels are, what the tax credit is, actually, not the okay, as you go across. So that figure under the age is the tax credit you'd be eligible for. That's at 100% of poverty level. Now we're looking at income of $34,000 for a family of 4 at 300%. Again, I'm not going to walk all the way through this because I think this gets a little confusing, and again, you can look at this. These 2 slides, the only thing I want to say about these 2, this is what your costs would be for someone who goes to the marketplace and is not eligible for a subsidy. And this indicates what your costs would be, what your deductible and co-insurance would be, and what your premiums would be. And the only reason I'm going to show you this is I then want to show you what it would be if you bought off the marketplace. And you see there's a little bit of difference. The one on the marketplace is a little bit less. But I just want to give you some examples. And again, I think this is a little busy, so I don't want to focus too much on that. So I think, Roger, we're back to you.
Well, I think you heard some of this a little bit before in terms of the initial enrollment period for the marketplace. It began on October 1st, but if you want to be actually enrolled and receiving the insurance on January the 1st, you need to enroll before December 15th. And I know that through the media that there's been a lot of talk about how people have had difficulty getting their applications in and what have you. And I would encourage you just to wait a little while until they straighten out some of those problems. A lot of the problems have to do with the capacity of the computer to handle a lot of applications at one time. So give it a couple of weeks. You still have plenty of time to enroll, and if it will make it possible for you to be insured on January 1st, if that's what you desire to do.
Yeah, there's no special break if you sign up now. So as long as you sign up by December 15th, and I think you've heard there have been some issues in going on the website and that. So as long as you get signed up before December 15th, you can have coverage by January 1st. So there's no need to panic right now. So.
And the other thing is the enrollment continues beyond December, this particular time, and I think it'll be the only time. So you can enroll actually after December right through March 31st, if you so choose to. But after that, what you're looking at is enrollment that will be basically the same enrollment period for people who apply for Medicare, and that's in November of the year typically. In terms of special enrollments, there are circumstances where you may not have a chance to enroll because you moved or you've got some other kinds of change in your life, or that there are some errors made at the marketplace, and so you have to enroll again or enroll for the first time. But let's talk a little bit about it. The loss of minimum essential coverage, because your employer, for example, changes their insurance. Now you're in a situation where you have to decide, what insurance you're going to take. And I know in a few companies, they've decided to give their employees a sum of money and go to the marketplace, whether it's the marketplace we're talking about here or private insurances, and say, go and buy what it is that you choose to buy. So if that were to happen, then you could enter into a special enrollment period for the marketplace under the Affordable Care Act. Gaining or becoming a dependent. People change ages. Despite all the complexity of the law, it's never stopped that. So if you change ages, if you've got a teenager in your home and maybe something has changed there, or that young adult is now changing from, we'll say, 25 to 26, there are those life changes that the Affordable Care Act and the marketplace will accommodate. Gainful, lawful presence, and maybe you can talk about that one.
Sure. I mean, what I would say about this is basically these are the sorts of things that happen under your insurance now. If you were to get married, you have a baby, you lose a job, your COBRA runs out. These would all be examples. You move to another state. These would all be examples of ways in which you could sign up for insurance past the special enrollment period. And that's not so different from your insurance now. I mean, if you carry insurance now and you have a child or something like that, those are life-changing events that cause coverage as well. Roger, I kind of slipped this up on you, didn't I?
Okay. We talked a little bit about the application earlier. It's available electronically and on paper in different languages to accommodate people who may be reading or speaking different languages. The federal form is a dynamic online, meaning that it's interactive. It'll provide you information to help guide you to the decisions that you need to make about the type of plans that you would like, or the levels of insurance that you would like within those plans. It's available to complete the application through Navigators, and we'll talk a little bit more about Navigators, I think, in another slide, or certified application counselors. Both of these groups of people have to be trained and certified by the federal government before they can provide services to you. Both of them are not advocates for one type of insurance or the other. They can provide information and provide eligibility type of information to you, and they can certainly answer your questions. These are more highly trained individuals, and we have some now in New Hampshire.
And the one thing I would say about that is you do not have to pay them. So if someone comes up to you and says, for $50, I'll help you figure this out. Don't do it. You shouldn't have to pay anybody to get information. There are people who have received funds to do this work. They've been trained up and they'll be doing it. I don't know, and here we go. So who are navigators in this area? Well, there's two that are on board right now. One is the Manchester Community Health Center. Phone number is listed there. The other is Planned Parenthood in Manchester, and the phone number is listed there. And I will show you later on where there is a website. You can either write those numbers down, or there's a place you can go look online called localhelp.org, which is on the website, where you can find where the closest navigators are. You basically either type in Hooksett, or the other town you live in, or you type in the zip code and it tells you who's nearby. The other possibility for people in this area, and particularly for people, for somewhat older adults and people with disabilities, is what's called the Service Link Resource Centers. There's one of those in Manchester, and they will also be helping people with this kind of work as well. And again, that's all without cost, just so that you're familiar with that. What should you bring when you're getting ready to apply? What should you gather together? Well, the sorts of things I guess you would think you normally would. Your Social Security number and birth dates, pay stubs, W-2 forms, policy number for any kind of current health coverage you have, and any information about any health insurance that you might be eligible for that you're not already taking. So, I mean, those are sort of make sense, and particularly if you're looking for a tax credit or a subsidy, you'd obviously have to have some wage information to make some projections about where you would fit into the process. All right, I want to talk about this a little bit. You saw in the video that there was this thing about states expanding Medicaid coverage, and some states have and some states haven't. New Hampshire's in a little bit hasn't done it yet, and it's possible that it will. We just had, and if you heard the radio today,